and the U.S. has been the leader in the funding position of the Global Fund. It has been the largest contributor of the Global Fund since its inception, and actually, while the appropriations committees are working on finalizing that number, it's likely the U.S. contribution to the Global Fund will be around $1 billion this year, which we're incredibly proud of. What's different about the Global Fund is that it's also a country-driven approach. So while a lot of the bilateral programs are working directly with countries, but it's a different process. What happens with the Global Fund is that countries basically create proposals and submit them to the Global Fund. And technically sound proposals are then given funding based on their ability to actually perform. And then they're actually only given money, continue to get money as they perform. So they, in their proposals, set out goals and objectives that the country must achieve, and as long as they achieve those objectives, the Global Fund continues to give money. What's an interesting and unique thing about the Global Fund is that when countries are not doing what they are supposed to do, while the Global Fund will clearly, and its partners will work with countries to fix bottlenecks and fix problems, we have seen issues in the past where there have been corruption issues in countries, and again, a different trait of the Global Fund is that it has actually suspended funding to programs. So that really leads to this sort of very accountable and transparent process that they have. So again, the accountability is very much part of their performance-based funding. They also have a very objective and independent review process. Actually, a few years ago, the United States actually had put this forward in the board to actually create an independent inspector general for the Global Fund. And that office has been in existence for several years now. And again, this is a part that is independent from the Global Fund, but again, looking at programs and really making sure that the things that they are coming back as far as results are working, and issues around corruption are solved if they exist. So again, the Global Fund's approach is exactly what Mark talked about. We have the tools, so what really happens is countries put together proposals in response to their malaria control programs, whether it's prevention or treatment. And obviously the Global Fund works very closely with the President's Malaria Initiative, and it's one of its key partners in the world to eliminate malaria. So really, as far as malaria is concerned with the Global Fund, again, it focuses on the 3 diseases, but a couple of years ago, something very interesting happened where at a board meeting, the issues around these MDGs, the 2010 goals and the 2015 goals came up, and there was a real interest on the part of the board to really push for countries to do more on malaria to meet these goals. And the country response was absolutely amazing. And what happened was we had a round of funding last year, and the size of malaria proposals exploded. And not only in the numbers, but actually the quality of those proposals. So what we saw was actually 94 approved proposals on malaria, and 51% of those focused on malaria. So literally half of the proposals that were done in that particular round focused on malaria. It was the largest round ever for malaria, and more than 2/3 of the requested malaria proposals were actually approved. So again, this was a real focus by the countries to do all they could to meet these goals and really tamp the prevalence of malaria in their countries. The Global Fund also focuses on health system strengthening, which I think is also an important part of malaria control, but also a more comprehensive global health strategy. And so obviously, in addition to ramping up programs on malaria, they're also building significant health systems in these countries by training healthcare workers and actually improving the infrastructure in which these programs are being implemented. So 35% of Global Fund grants actually go toward human resources, infrastructure development, and other health system strengthening activities within the 3 disease components. So in places like Rwanda and Tanzania, when malaria is addressed, the health systems are actually, as Mark mentioned, we're starting to see a lot of empty beds there, and that's because malaria is being taken care of, and actually those hospitals, as we say, can actually be hospitals again and look at other areas of health and really treating patients that are suffering from other health problems. So the Global Fund has been incredibly successful in a very short period of time. Mark mentioned a couple of stories, but I'd actually like to mention one in particular. It's the Lubumbo region of Africa. And this is a malaria endemic region that covers southern Africa, which is parts of South Africa, Mozambique, and Swaziland. And in 2003, Mozambique alone had reported 5 million new cases of malaria. And obviously compounded by issues around poverty, the burden of malaria was really creating a huge problem for people in this region. And thanks to the Global Fund, along with some other donors, this area has really become a huge success story. The malaria incidence in this region has been reduced by almost 90% because of Global Fund funding. And it is a multi-country effort, so actually it's not only affecting one country, it's affecting this entire region. And this is a huge success story for malaria, and I think we're starting to see more and more of those stories come about. So how does the Global Fund fit within a larger U.S. policy? As I mentioned, the Global Fund has been a critical tool in both the president's malaria initiative, but also the president's AIDS program as well. But as I'm saying, obviously, the Global Fund's impact is going beyond malaria, and it's really a critical tool in an overall global health strategy, and let me tell you a couple reasons why. One is, obviously, there's integration. It is dealing with AIDS and TB and malaria, but as Mark mentioned, it is also having an impact on maternal and child health as well as health systems. Malaria, as Mark mentioned, is obviously an issue that affects women and children for the most part, but also what we're starting to see is with HIV, we're seeing the face of women more and more in those issues. So it is not just looking at one or two things, it actually is creating a more integrated approach. Another interesting aspect of the Global Fund, which is related to the financing, is a leveraging effect that occurs. When the Global Fund was actually first created and the U.S. created the original legislation for the U.S. to participate in it, a rule was passed that for every dollar the U.S. provided, the rest of the world needed to provide another $2. And in this day and age of looking at programs that are effective and efficient, the Global Fund really provides the United States a way to participate in this global health arena, but obviously utilizing other countries to also support those efforts. So again, the U.S. isn't in it alone. It is actually working very much in partnership with the rest of the global community. And obviously the Global Fund has a huge geographic reach. It works in 140 countries around the world. And I think the other point that I want to make is, again, piggybacking on what Mark mentioned, is this issue around health diplomacy. The U.S., from the beginning of the Global Fund, has been a key leader and partner to the Global Fund. Again, not only in funding, but it holds a very important position on the Global Fund's board of directors, and it's really an opportunity for the U.S. to work with other countries and other key players in the world in fighting these diseases and obviously working toward a better global health approach. So again, I think that the U.S. has a real opportunity to continue that leadership by providing additional support for the Global Fund. And finally, obviously we've talked about this, and I think this is sort of our main goal, main theme here, is that eliminating malaria is absolutely achievable. And I think what the Global Fund's work is really providing is something that we like to call evidence-based hope for millions of people around the world, people that would have died without this funding. And I think that as the U.S. continues to be a strong supporter, there's a real opportunity for us not only to eliminate malaria by 2015, but also creating a very strong approach for global health around the world.